Well, welcome back to Prescription for Progress. Hello, everyone. I'm Raj Kumar, the President and Editor-in-Chief of Devex, and excited to start a special session in partnership with GSK, where we've got an exciting announcement you're going to be hearing for the first time. And before we get into that, let me just mention who you're seeing on the screen here with me. We've got Dr. Pauline Williams, who heads up the research and development area in global health at GSK. She's a senior vice president at the company and is focused on malaria and TB and other disease areas that are so impactful in the global south. And we've got Dr. Garges, who's with ViiV Healthcare, which really is a company that focuses on HIV treatments, and they are majority owned by GSK, work in partnership with GSK. And so we're going to have a discussion about some of the disease areas that we're talking about a lot today at Prescription for Progress that affect many millions of people in many low-income and fragile countries that may have been off the front pages a bit this year. And we're going to get into this announcement that I think you're all going to find very interesting. So to begin, I'm pleased to queue up a video here from our friend, Dr. Gitinji Gitahi, the CEO of AmRef Health Africa.
So this is the partnership that we are working on with GlaxoSmithKline, which is going to be launched in February. And it is aimed at, one, reducing the burden of disease and death, and also reversing the negative effects we've seen of the COVID-19 pandemic, and ensuring that we can actually start to accelerate the gains that we were having before. This is the partnership that we are building on and repurposing and recreating with our partner GlaxoSmithKline. So AmRef Health Africa and GSK have been working for over 30 years, and we've been working in different areas of the health sector. We've been working on areas of innovation, innovating new areas, new ways of doing things. We've been working together on community engagement, looking at what are those barriers that communities face that we need to help them overcome, or we work together with the communities to overcome those barriers. We've also been working on areas of training health workers and capacitating health workers. And now we are looking at this partnership in terms of how do we leverage the more than 30 years of work to actually build robust cross-sectional and kind of horizontal changes to the health system to overcome the challenges that malaria and TB bring to the communities as a critical burden to achieving sustainable, lasting health change for communities. So we are looking at how do we leverage our various strengths. We leverage the community engagement strength that AmRef has, and leverage the research and development strengths of GlaxoSmithKline to bring to bear our interventions for TB and malaria, specifically in these two high-burden countries of Kenya and Ethiopia.
So, Pauline, we just heard from Gitinji a little bit about why you're engaged in this partnership, but maybe you can tell us a bit more about what the partnership actually is. What is GSK doing with AmRef, and why is it so relevant at this moment?
Thanks, Raj. Well, I mean, it's great to use this Prescription for Progress platform to launch this really exciting partnership. And as Dr. Gitahi said, this builds on decades of experience that we've had with GSK partnering with AmRef, and a really fruitful partnership. But this is really specific and timely, as you said, in terms of recognizing the impact that COVID-19 has had on really setting back the progress that's been made in really responding to the challenge of malaria and TB. It's a program that is over 2 years. It's based in specific regions in Kenya and Ethiopia. And it's community driven. It's very much aligned with local healthcare policy, so that makes it sustainable. But it really is looking at equipping communities to really recognize signs and symptoms of disease, and so promoting healthcare seeking behavior, but then a very dedicated healthcare worker training program to give those healthcare workers the tools that they need to really support surveillance of disease at a broader level, but also specific signal detection and symptoms so that they can provide the appropriate diagnosis and treatment. And it's designed to be scalable. We see that this is an opportunity not just to expand across regions, but also across diseases as well.
All right, I want to dig a bit more into the partnership, how it works, because it sounds like you're getting to a key challenge that is faced in many healthcare settings around the world. If you don't identify the patient early, diagnose early, there's no way to get them into a care setting and to ensure they're getting the care that they need. But maybe we can bring Harmony, you into the discussion. You're the chief medical officer at ViiV, and you've got a long history of really doing drug development and clinical trials. So you're very much as well, like Pauline, on the R&D side of things. And yet we've all learned in the pharmaceutical industry and beyond that it's not just about developing something, an intervention, a medical device, a drug. It's about how do you deliver it to people. So what are the gaps that COVID-19 has created in the areas you work in HIV or malaria, TB? I mean, we can all get into that and then think about how this partnership helps address that.
Yeah, it's a really important point, Raj, and it actually resonates with one of the sayings I use with my team all the time, which is that you can discover and develop the best medicine in the world, right? But if you can't get it to the people who need it, we haven't done our job. So, what COVID-19 has brought home, I think, is how fragile some of our healthcare systems are in many parts of the world. And we've definitely seen an impact of COVID-19 across the HIV community. So we've seen the impact on people living with HIV. We've seen the challenges that healthcare professionals have who are trying to administer the care, ensuring their patients can get access to antiretroviral therapy. And we've certainly seen the impact from a clinical trial perspective as well. But
and a lot of this is because you've had shutdowns, right? You've had economic shutdowns, or people can't get to their facilities where they might normally get medicine, or maybe the economy has been hit so hard that they don't have access to the basic nutrition they need to go along with a medical regimen. Is that right? What do you see as some of the ways the pandemic has actually impacted people living with HIV?
Yeah, all of the above, everything you've highlighted, Raj. So I was just on a call last week with one of our partners, an Italian NGO known as QAM, that works for in capacity building, right, with some of our physicians in Mozambique, in Beira, who has been hit by natural disasters as well as COVID. And it really brought all of this to life. So it's been incredible, though. What's been so inspiring is seeing what they've been able to do to overcome those barriers. So using new innovative technologies, mobile phone technologies, to make sure people know where to go to access their antiretroviral medicines, coming up with creative solutions for how those can get delivered. And from our perspective, in terms of clinical trial supply, we've been making that a primary focus. And I'm proud to say we didn't have a single stock out of any of our clinical trial supplies in light of this, but it's only because of the dedication and the extra effort by our partners on the ground who have really been able to help us mobilize all the resources required to meet those needs.
Yeah, you were talking about how clinical trials can be affected. I was trying to think of, well, what are the many ways? And that's certainly one, right? If the supply chain of the drug itself gets interrupted in some way, you interrupt the clinical trial, maybe you can't use that data, and it could be a really significant challenge and delay to developing a new therapy. Have you found that during the pandemic, because of all the disruptions, the many reasons we've gotten into a bit of, that patients who contract malaria or TB don't get care as early as they might have before this pandemic? Is care being delayed because they don't go to the medical facility early enough? What are you finding in those two disease areas?
Well, I mean, from the R&D side, definitely we've seen that we've got a study ongoing in TB in South Africa, and that has been the case where that study has been significantly delayed for the reasons that you just articulated. And I think, it's very regional. We can't make gross generalizations, but I think we certainly are seeing examples where lockdown is inevitably restricting people's movement, and that's got an impact on transmission within the household for TB, for example, and perhaps a reticence then to leave and travel to get healthcare interventions, and then the healthcare professionals themselves being redirected very much towards COVID response. And so that in turn is having an impact, and supply chain disruption in cases for diagnostics and treatment as well. So it's really a big impact. And I've just been looking at some modeling work that's been done by Stop TB and USAID with Imperial that has really shown some quite concerning projections for even the impact of a short-term lockdown. And they've looked at Ukraine, India, and Kenya, with assuming a pretty rapid return to steady state. The impact over the next 5 years on case rates and excess mortality is really quite stark. And so I think, you know, now is the time to really introduce or continue the momentum that we have in addressing these diseases.
Yeah, we've been covering this a lot at Devex, that there's this kind of silent wave that's going to come that we're not paying a lot of attention to now, but we're not seeing it too much in the data yet. But the modelers suggest it will be here as we kind of ramp down on the coronavirus in many parts of the world. You'll see, you know, potentially many of these untreated health conditions grow, unfortunately, with a huge burden. You know, it seems like, listening to both of you, that partnerships, this one in particular, but maybe others that you're engaged in. I'm just reading that you've got a partnership with ViiV and with CHI and UnitAid on accelerating the development and availability of optimal HIV treatments for children and adolescents. It sounds like partnerships maybe has become a more important thing for you because of the pandemic. Has your perspective on the idea of partnering changed in the last year and a half or so? Maybe Harmony, you want to jump in?
Well, I'll start, Raj. I mean, partnerships for ViiV is really at the core of who we are. You know, as a company, we're a joint venture with GSK as a majority shareholder, but with 2 other partners as well. And so it's really at the heart of who we are as a company. And we've always leveraged our partners very heavily. We have over 50 organizations we partner with, whether it's in the research and development space through various academic partnerships and academic organizations, whether it's in the community space, you know, through other partners in terms of helping us with generic preparations and getting access, and even in the policy space as well. So we've always levered partnerships very heavily from a ViiV perspective. But what I believe COVID has done is just galvanize that, right? It's just shown us that this is so important to everyone, you know, especially when you're talking about the burden of HIV. It requires partnerships. You know, one company, one organization cannot do this alone. And when you layer COVID on top of that, it's just really brought to light, I think, for the global community, how important these partnerships can be. And to highlight it from the HIV perspective, similar to what Pauline said, you know, many of the global HIV organizations have done modeling and calculations showing that COVID has definitely impacted who's getting tested. You know, we always struggle with that anyway, and this has made that challenge even greater. And who's accessing antiretroviral therapies. And they've projected it both in terms of what that means for adults and adult mortality, as well as what that means in terms of mothers passing HIV on to their children as well. And some of the statistics are staggering. You know, if you look at the percentage increase that they're projecting out in these populations, it's quite striking.
Yeah, and we know that, you know, the inequalities that existed before the pandemic, they're going to get, you know, exacerbated dramatically whenever you have a situation like this. And so the people with the least access, they're going to do the worst. And if we don't do something now, and partnerships like this are a part of this, to address it, we will be dealing with this in the statistics and in the human tragedy in the years to come. Pauline, we only have a minute left, but I want to turn to you for a sense of a call to action, maybe for this audience here following us around the world for our very future-oriented event here, Prescription for Progress. What do you want people to take away from your announcement and from our conversation today?
Well, I mean, I think it's just to build on the point that you've just discussed. I mean, partnerships are absolutely critical. We've seen some really non-obvious partnerships created through COVID-19, and let's build on those, and let's really think about how we can work across sectors to really address public health challenges moving forwards.
Yeah, and it's interesting for me to hear that coming from you, Pauline. You know, you lead a team of scientists, of innovators. You know, your people are working in labs, and yet now we realize that in the global health community, it's everyone from that scientist all the way to a community healthcare worker. We've got to be aligned. We have to have one strategy, or it doesn't work, right? We're only as strong as the weakest part of our of our health systems. And certainly if COVID has taught us anything, I think it's taught us that. It's great to be with both of you. Thank you for bringing this announcement to the Devex stage here at Prescription for Progress, and we wish you well with it.
Thank you very much.
Appreciate the opportunity, Raj.